Now it's finally here, the Joy Business Health and Wellness Trade Show, live at the Accra Digital Center. Let's cross over to the Digital Center and hear Professor Ajimambidu Akosa, who is currently addressing the gathering.
Ghanaians will begin to know the things that are good for them. So all processed foods, you're importing cars, you're importing second-hand tires, all those things, you can just put little levies on it. I'm saying every major construction here is not only environmental impact assessment, there should be a health impact assessment. And the health impact assessment also attracts a little cost that goes into the national health insurance. So we look at the wider social determinants of health, and we can look at so many little ways. Somebody might say all that is difficult, but I'm saying we can have an average quantum of all this and say that this quantum is equivalent to 1% of VAT. So yes, we would add 1% of VAT to national health insurance, but all that will be collected for the consolidated fund. You understand? So you identify your areas where you can make money, and those monies are justifiable because those things either produce ill health or does not contribute to our well-being. We want you to take steps, and then you go and buy a lift. So in buying the lift, there's a little charge on the lift. So that goes to help those who were prepared to walk. You understand? In this country, I just wished that anywhere from Tema Station, the old Tema Station, the electricity, the hockey stadium, all right, all the way to Anglican, which is the Blast Bank, yes, the Anglican, or to Watto, the whole of that area should be pedestrian only. No car drives there. If you venture there, they will charge you tax and give it to national health insurance. All these things can be done so that people will walk. If we do that, we'll grow trees and we'll have shade so that people can walk. Because walking is the best form of exercise that sorts out all these non-communicable diseases: hypertension, diabetes, cancer, kidney disease, tobacco and alcohol, you know, all that. And Ghanaians, we like sweet things too much. We like sweet things. You're an adult and you eat sugar like a little child. You don't know that if a little child is never given sugar, it will never miss it. But we will load everybody sugar and here. So people, young people are drinking energy drinks. What for? It contains mega calories. You are preparing yourself for diabetes eventually. And no kidding. The number of people who have diabetes in this country is huge, but the number who are waiting to be diagnosed as diabetics is even bigger. And it's the same thing with hypertension. Those who have had their blood pressure checked several times and it's gone 140, 90, and they say, hey, you are hypertension. But those who are 135, 85, and it's creeping, 87, you are there. Very soon, you will get there. So we, as a country, must also create an environment that makes sure that everybody is in good health. If we do that, I think the national health insurance will be sustainable. Of course, the private sector comes in, and the private sector can do its private mutual and private health insurance. If you've got the money and you pay, now there are first-class facilities in this country. As soon as you cough, you don't go to any of these places where, like most people say, there are too many people. Hey, you have money, so you don't want too many people. You can go to the high end and go and pay $500 for cough. That's all right. But I've paid my premium. I have national insurance card. Fine. My name is Professor Akosa, so if I get to any hospital, I'll be seen quickly. But that is because I am part of the health fraternity. And I don't keep my mouth shut, and I speak. So if you waste my time there, I might go out and go and say, this clinic is bad because they waste people's time and so on and so forth. So they'll see me quickly. But let me say that in Africa, we lead in our national health insurance. And however bad it is a very good platform for getting to universal health coverage. And I want to say that in trying to get more money for national health insurance, they must also reduce their management cost, efficiency. My brother, you heard this organization, if the efficiency savings are not there, will you survive? So national health insurance management costs should not exceed 15%. And then the money that is given to MPs. As for legislatures, anytime there's a fund that is created that goes to Parliament, then they'll write their name inside before they approve it. So they get fund. They get national health insurance fund. What for? To make advocacy. Who is doing advocacy there? They will register a few people and they say, we have done whatever. Take that money out. Just add it to the quantum so that everybody can benefit. If we do that, and we police our national health insurance fund very well, I think it will go a long way to universal health coverage. It can be done in this country, and let's use our own cultural settings to advance this cause, and I think we'll be the better for it. I thank you very much.
Thank you very much, Professor Ajiman Bedu Akosa. You know, they say that experience is not necessarily about how much time you spent doing something or being exposed to a thing. But I think in your case, it is rich experience because you've justified your length of time you've spent and the experience with very sound wisdom. We will now move to our final speaker who will be talking about leveraging technology in the healthcare value chain. And I think that it will hold some nuggets for us to refer to when we start our Q&A. Technology has fixed problems elsewhere, and maybe it holds the key to some of what we face today. Please help me welcome Dr. Elvis Kumaforsin. He's a health technology enthusiast.
I need them to fix the power. Good afternoon. I'm talking on technology, so I have to leverage some of it. I want to say thank you for this opportunity as well to Joy FM. And I feel like I'm called to summarize some of what my senior colleagues have said here. So I'll be very quick. Yep. Yes. All right. So leveraging technology in the healthcare value chain, it's self-explanatory. We're just asking how can technology help us to better the processes that go into the provision of healthcare. I just want to state that all that we do in technology still has to be targeted towards the achievement of the the SDG, which is to ensure healthy lives and promote well-being for all at all ages. So I'll very quickly go through a few slides. I'll introduce what I'm doing, the healthcare value chain. We'll try and find out what it is. I have an adapted one. The pain points that I think technology can work on, then why we can find these, where and why we should find these technological solutions, factors that can create the right environment, where we are now in Ghana, exciting, and then what I think we can have in the future. Technology in general can be divided into two in the health sector. That has always been there to do with MRIs, chest X-rays, microscopes. But in the spirit of what I was given, I think that they are referring to the more recent technological solutions that have to do with the internet and the mobile phone age. So that's what I'm focusing on now. A quick look at what the health value chain looks like. You have the payers or the patients, or now we call them the clients. And we've heard about the NHIS, employers who also pay for their employees. And then we have the mighty individuals who have to take out money sometimes to top up what they are paying or what is required for health care. Then you have people who are charities and philanthropy, those who work through philanthropy. Insurers also are part of the value chain. Then we have providers, of course, people like me, both nurses and doctors and other allied health like physiotherapists, everyone who is in the healthcare industry, including the mighty pharmacists, and indeed the alternative and what we will call herbal care providers here in Ghana. Then we have the distributors. I'll jump that because it's very similar. And then we have the